Alice Costa, licensed practical nurse, student at Vermont Technical College, and a volunteer here at the clinic. I know we're all committed to providing our patients with the best care possible within the limitations of the budget of a unique clinic such as ours. I'm here today to propose a new approach towards meeting that goal: Complementary and Alternative Medicine, or CAM. CAM is an umbrella term which refers to a number of modalities that are used to increase health and wellness and are not part of a conventional Western medical practice. The term integrative medicine is now commonly used to refer to the combination of CAM and conventional medical treatments. Our clinic would fall under that umbrella with the addition of CAM, so you may hear that term used as well. A healthcare facility that offers only conventional medicine has three potential problems. The treatments, testing, and procedures used are costly to both facilities and patients. A reductionist or targeted approach targets only individual symptoms, often failing to prevent their recurrence. And viewing the provider rather than the patient as in control of health outcomes increases provider liability. I believe the solution is integrating CAM into our practice. We'll take the time today to discuss the problem so that you understand the need, discuss the solution along with a proposed budget for implementing the solution, and we'll take time at the end for question and answer. I appreciate your taking the time to be with me here today. According to a report by Jason Kane for the Public Broadcasting Service, the United States spends more than 2.5 times that of other developed countries on health care. That's 17 cents on the dollar here in the U.S. And yet we have fewer hospital beds and fewer providers per capita and a shorter life expectancy here in the U.S. So where is this money going to? According to the PBS report, the cost of U.S. healthcare spending cannot be attributed simply to our offering more services, but rather to our relying on more expensive services. Conventional medicine uses what has been called a reductionist or targeted approach, targeting individual symptoms and often treating them pharmaceutically. The failure to consider a patient holistically and address underlying lifestyle or other factors that are unique to each patient has been criticized by those like Dr. Frank Lipman as treating the disease, not the patient. According to an article published in the journal Acupuncture, the failure of this approach is evidenced by the fact that when treatments or medications are discontinued, even after years of use, the underlying problems remain. Those health concerns have not been fully resolved. And indeed, a conventional medical approach has proven unsuccessful in stemming the plague of chronic disease, such as heart disease, type 2 diabetes, hypertension, and the number of conditions that are affecting this country and our patients. Conventional medicine does not require the patient to play an active role in their own recovery and health. The provider is seen as in control of health outcomes, and as a result, lawsuits and scrutiny against providers by patients whose conditions either worsen or persist have become common. According to an article published this year from the American Academy of Orthopedic Surgeons, the risk of liability is driving provider behavior and decision-making in a way that is eroding the doctor-patient relationship, increasing healthcare costs, and negatively impacting patient safety. I believe the solution is CAM. It's cost-effective, holistic, and patient-driven. Let's look into this a little further. In a review of literature relating to the cost-effectiveness of CAM, the economic evaluation of complementary and alternative medicine, published in the Natural Medicine Journal, it was found that CAM is cost-effective and may present a cost savings due to inexpensive treatments, less reliance upon technology, and an emphasis on preventative medicine. CAM is holistic. The Wheel of Health, developed by Duke University Medical Center, is one model of an integrative health practice, one that perhaps we could adopt ourselves here at the clinic. So on the outside, we see what a clinic like ours could offer: conventional and CAM treatments, pharmaceuticals and natural supplements, and an emphasis on preventative medicine all make up this blue outer layer here. Within this is patient self-care. The green includes areas of the patient attending to their own requirements for nutrition, exercise, spirituality, and mind-body health. So the patient is seen as really central here, that emphasis on patient responsibility, supported by our integrative healthcare services. And then here in the center in yellow is mindfulness. And we know that many CAM modalities do put an emphasis on mindfulness, which has been proven beneficial to health outcomes. So why are a growing number of healthcare facilities offering CAM in addition to their traditional services? We know this is a growing trend, and this chart from Health Forum breaks down the main reasons that hospitals are choosing to offer CAM. Number one is patient demand. There is an audience for these services. Patients want them. They're clinically effective. They reflect the mission of the hospitals that are offering them, which I believe is true of our clinic as well. They attract new patients, which at our clinic also means increasing interest in the community attracts not just new patients, but potential new volunteers and donors. So it's important to do things that are going to raise that interest. Physicians are requesting these services. These services differentiate the facilities offering them from their competitors, which again for us is helpful in broadening our donor base when people have choices of who to contribute to. And there's a potential cost savings to be found, as well as other benefits. So these are the reasons that a growing number of facilities are offering integrative medicine, and I believe that we would realize many of these benefits here as well. There are numerous CAM modalities that could be offered and targeted for numerous specific health and medical conditions. I wanted to give you one concrete example here today, and I chose CAM and smoking cessation, which is significant to our clinic, where we do receive funding based on tracking data regarding the smoking habits of our patient population and being able to document that we're providing referrals and services to those patients who are feeling like they're ready to quit smoking. Pranayama, or yogic breathing exercises, can be used to aid in smoking cessation, and this is something that a patient could do independently, free of charge, in their own home, following proper instruction from a provider here at the clinic. Additionally, there are acupuncture points that can help in this process. So if we did identify through our initial patient screenings someone who was feeling interested and ready to make the step to quit smoking, we could refer them to an acupuncturist if this was a service that we offered at the clinic. I'll talk now about the budget. Much of what is done here at the clinic is made possible by volunteers. Our nurses, our primary care providers, and our reception staff are all volunteers. For this reason, I would envision this project as being primarily staffed by volunteer practitioners who are trained in complementary and alternative medical treatments. I do believe that the successful implementation of this project would require that we hire part-time for 1 year a project coordinator. So this would be the one paid staff person in this project. hiring a coordinator at $15 per hour for 12 hours a week with some additional floating hours throughout the year would come to a total of $10,000 for the first year. And this coordinator would be responsible for the appropriate allocation of an additional $5,000 budgeted for project promotion. That should adequately cover the needs of mailings, light mass media, such as local newspaper, TV, and radio, and social media to get the word out to potential volunteers, clients, and donors about this new project. The total budget for the first year would be $15,000, at which point, after 12 months, the budget and project would be reviewed with the expectation that the same level of coordination and promotion would not be required going forward. So these are costs for the first year only. In conclusion, it's no wonder that multiple polls, including those from Gallup, CBS News, and the New York Times, are finding that Americans are deeply dissatisfied with our existing healthcare system and view it as fundamentally in need of change. We all need to strive for that change, or we'll be facing the problems discussed earlier with relying on our current conventional medical approach. We need something that's more affordable, that's holistic, and that's more patient-driven. Integrating CAM into our clinic would meet all those needs. Studies conducted by Duke University found that patients who participate in an integrative medicine program realize more profound health benefits than those who do not. It's clear to me that integrating CAM into our existing services is good for the clinic and is good for our patients. I thank you so much for taking the time to listen to this here today, and I'd like to open it up now to any questions that you may have. Thank you.